Hello, everyone. This is Cole from the American Journal of Healthcare Strategy. I'm joined this evening by a really special guest, Keya. Keya, please introduce yourself.
So, hi everyone. My name is Keya Gupta. I am a organizational consultant at UCI Health. I work under the Program and Performance Management Office, and I lead various operational and special initiatives for our Chief Operating Officer and Chief Nursing Executive.
It's great to have you on because we get to see the outcomes here of an administrative fellow. You recently exited that back in April, right? And so it's great to talk about people who, what the outcomes look like post fellowship. So that's wonderful. Going back to undergrad and grad school, how did you find your way into healthcare administration?
So, I think that's it's a very interesting question and also kind of a long-winded answer, but I'll try to keep it, relatively short. Growing up, I grew up in a family of engineers. My dad worked at NASA for over 40 years. And so, him and everyone else in my family, nobody was in any career remotely related to healthcare, but I think as I was growing up, just being a first generation South Asian American from, growing up in an immigrant family, one of the things that was always touted was, you should either be one of like the big three, which is like a doctor or a lawyer or an engineer. And so I knew from very early on that I was really interested in science and STEM. And so I had originally set my sights on becoming a doctor, and my parents were like fully behind that goal. And I think it's interesting. I think the only reason I kind of wanted to go that route is because I didn't really have an idea of what other careers were out there in the healthcare world. And so I just felt like, when you think healthcare, like you think like something clinical immediately, I feel like. So it's like nurse or doctor or
Right.
something like that. And so, I had set my sights on that. I went into college. I did my undergrad at UC Irvine, and, set my sights on getting my public health degree because I had originally thought I would just, finish my prerequisites for med school and go that route. When I started college, I also had the opportunity to intern at a local community health organization called the Down Syndrome Association of Orange County, and that's in Costa Mesa, California. I had to complete some hours in order to graduate from UCI, and so I ended up doing my internship with them. And during the 6 months that I was with them, I met a lot of public health leaders, like in our Orange County community, who were building these programs for the benefit of our communities. And then during my tenure at that organization, I had the opportunity to design and develop and implement programs for adults and adolescents and also children with Down syndrome. And so I noticed that a lot of these leaders who were, leading organizations and community health organizations had their MHA. And I didn't really know, I had no like introduction as to what that was. And one day I reached out to one of the leaders in an organization that I worked closely with, and I said, how did you get this degree? What is this degree about? And so that was kind of like my first intro into what healthcare administration or healthcare management really was. And so, by the end of almost at the end of my undergraduate career, I had kind of already started to like switch my mindset into, stepping back from clinical, but maybe going into something on the management side, only because I felt like, maybe this is where my strengths lie. And in that time also switched my major in undergrad from public health to psychology, which was something of interest to me. And so As I did that, I started, trying to think like, what am I going to do, for grad school? Am I going to go the healthcare admin route? Am I going to go the psych route and get my doctor of psychology? Like, what do I want to do? Um, and, after I graduated from UCI, I was hired on full time by the Down Syndrome Association of Orange County and was there for a couple of years, and really just connected with the community, became so passionate about um, uplifting and empowering those teens and adults with Down syndrome, especially. And I just felt like, healthcare admin was the right path for me. And so ended up applying to Concordia University, which is right down the street from UCI. It's a small but beautiful little private university that just had an incredible MHA program that was really set up for individuals who like wanted to work and gain experience working while they were doing their MHA. And so that's kind of like how that was kind of like the my I guess my thought process and journey into getting into that. On the personal side of things, I will say, I would say like at the end of high school, kind of starting undergrad, my dad actually started to fall ill. And so he got diagnosed with Parkinson's disease, as well as end stage renal disease. And so had to start dialysis and things like that. And so I was kind of put in this position as like the firstborn, just that having that responsibility of trying to understand like what his care would look like, taking him to doctor's appointments, to his dialysis appointments, and really just being that like advocate for my dad, but also being that spokesperson, and middleman kind of in between like the doctors and my parents, and just being kind of that glue. And I feel like in some ways, and that I was able to kind of glean some like care management skills, and so that was really interesting, and just kind of seeing how the care system or the healthcare system worked through my dad's eyes, like from a patient's perspective, was also, during this time, throughout my undergrad and graduate tenures, seeing that patient care perspective is also kind of what catalyzed my passion and like drive for wanting to get into healthcare admin. And I just became, I think, just really interested in understanding what culturally competent care looks like and should look like, and what, you know, equity in care should look like for the future. So those are just kind of some of my interests, and just wanted to share the personal kind of part of my journey.
That's so important, that that personal connection that helps you to be a better advocate for patients, right? And that's really what the duty of the healthcare administrator is, right? We're supposed to keep care efficient, keep quality high by supporting our clinicians and advocating for the patients. And so that's so important. I thank you for sharing your personal experiences, and I love how valuable those real world experiences have been for you. I think that's something to encourage the undergraduate and graduate students, is to seek out these opportunities. You were also appointed to the ACHE Board of Directors shortly after getting your MHA, and you serve on some other boards as a director there, and then you've had success with these internship opportunities. So you're a very employable, recruitable person. Do you have any advice on how early in your career, right, before you have the 10 years of practical experience, how you've been successful at getting in the room?
I think it starts with honestly just very simple things, being curious, asking questions. And when people see that you are interested in growing and learning, a lot of times they automatically take an interest in your growth as well. And so when I was, I think like end of first year of my master's program, I reached out to my program director and I said, hey, I'm really interested in finding some sort of opportunity that's going to help kind of bolster and supplement the education that I'm getting in the program. Is there anyone you can connect me with, or any sort of project that's going on kind of behind the scenes that I can get involved with? And so fortunately, she actually knew somebody from our local Southern California ACHE chapter, Dr. Trisha Kassab, who at the time I believe was a VP of Quality at Adventist Health and was on the board of directors of ACHE SoCal, and was looking for someone to complete a project with her, a student who just had that bandwidth. And so I was introduced to her and another one of my colleagues who also serves on the board of directors now with me as well. And she was at USC at the time. And the three of us worked together on building this video that really documented over 50 years of ACHE SoCal history, something that had never been done before. And so that was kind of like my first just kind of little bit of dipping my toes into the world of ACHE and that organization. And from there, Dr. Kassab literally took me like under her wing and was like, you need to get involved with ACHE. You need to get involved with student council. And so they had a student council, got involved with that. And I also saw like some opportunities that I felt like maybe the board, themselves would be interested in having a young student like myself kind of help them out with. And for them, that was kind of like social media or website. I really felt like the organization was doing some incredible work and just didn't have like the social media reach yet. And so I kind of stepped into that role and started doing stuff by myself. And eventually, leaders in ACHE SoCal kind of noticed, and that's kind of how I like stepped into the chair of the chair of communications role that I now hold and have held for the last 2 years. So yeah, again, just going back to the advice: be curious, ask a lot of questions, go to networking events. It's really tough to put yourself out there as a young student because you go to these events and you see these executive leaders and you're like, they don't want to talk to me. Like, they're not going to like that I go up to them. But the reality of it is, and someone told me once, that everyone puts their pants on the same way every morning. And everyone that goes to these networking events is interested in networking. And so these leaders are just as interested in getting to know you as you're getting to know them, and you are in getting to know them. And you have to like overcome that mental block, and it's really tough. But once you do, like, you'll continue to do it and you'll start growing and making those connections.
That's wonderful. Yeah, thank you for sharing that. I found that to be very true with my networking events that I've gone to. And so, over the 2 years that you were on the that you've been with social, the communications chair, how has your success been? Have you seen a good growth in the social media?
Absolutely. I think when I started, our LinkedIn probably had maybe 1,000 followers. We just about crossed the 6,000 follower mark not too long ago, and our Instagram as well has grown, I would say, by triple over the
Wow,
last 2 years. The first year I was kind of getting my bearings and really just kind of built out what like our communication strategy would look like going forward. And then in the second year, because we had so much of a demand from our members to see more, I ended up building out a committee and just I've had the opportunity of working with some really incredible individuals who now oversee all of our social media. I have a couple of individuals who oversee our newsletter. We do 4 newsletters a year. And we have a historian. And so we've
oh,
really,
wow.
really just grown, and it's incredible. And it's so needed for our chapter because our SoCal chapter has also grown exponentially over the last 2 years. So it's been an amazing experience.
So this is an interesting question on that, right? Is why is it important for these healthcare executives like yourself? And I know we're going a little bit off in the other direction here, but I just wanted to ask, why does it matter that you understand social media and that you have people in that area, right? Because a lot of organizations think, oh, we'll just outsource this. We don't need to
Mhm.
learn about it, right? But you found great success in knowing how these things work. why is that important? How do they actually benefit from knowing that information?
Well, I think social media and now, with the added AI kind of journey that we're all on, is it's just a fact of the current and future.
Hmm.
I think that, I mean, it's great to outsource some of these things, but um, really having somebody who, understands, what social media does to benefit an organization, but also has that background in healthcare or whatever industry you're working in. It's beneficial because those individuals are able to really connect the dots in terms of building out that strategy for how your organization should grow. And they're really able to target different, I would say they're able to target different constituents that these organizations need to target as they continue to grow. So that's my take on it. I think at any given time, really, and now I'm kind of going off on a tangent into, working with different generations. But if you think about it, especially in healthcare, like at any given time, you have at least five generations working together in healthcare. And so I think the real question for the newer generations, Gen Z and beyond, is what are we doing to um, number one, be flexible with working with all of these generations, and how can we use that to our advantage as we grow into our leadership?
5 generations. That's interesting when you put it in that perspective.
Yeah.
Wow. And thank you for sharing that that message behind how important that is. Really appreciate that. So shifting gears back to your journey, right? You've done these incredible things, and then you decide to pursue a fellowship. You probably, and I ask a lot of fellows this, and everyone gives me a different answer, and that's why I keep asking it, because it's so important. Why did you decide to do the fellowship instead of continuing on in industry? You most likely could have gotten, a promotion, or continued to level up. So why was the fellowship chosen? Why was that valuable?
I think that's a good question. So once I graduated from my MHA, I actually, so I didn't go straight into a fellowship. I actually was set on not going the fellowship route. And so I actually started working at Palomar Health, which is a community hospital system down in San Diego. So I was working in the organizational development space there, and I did that for about a year. And honestly, I just really felt like I was missing something. And I think organizational development is such a great space and a needed space in healthcare. But I felt like I really needed to gain, I needed an experience where I could gain more knowledge, number one, about what other areas in healthcare there were, because I didn't really feel like I had found like my space in healthcare yet. And so, because of that, I decided to pursue an administrative fellowship, and it's really interesting because I thought I was gonna do like 30 to 50 applications, and I ended up only applying to one that I saw just like pop out on LinkedIn very early on, even before fellowship season started, and I applied to that one, and that was the one that I ended up getting, and it happened to be 50 minutes from my house. So I think things just kind of aligned. But yeah, at the end of the day, I wanted to grow, but also to kind of explore my interests in different areas.
That's incredible. So you have 100% acceptance rate.
Yeah.
So, so why just the one?
So, I mean, uh, I think a couple of different reasons. I think if I didn't get into this one, yeah, I would have gone on and applied to the others that whose applications were coming out maybe 4 or 5 months later. But by that time, I was already kind of in the end stages of the fellowship that I accepted the position for. Um, I would say this organization in general was CalOptima Health was an organization I had always had my eye on. I would be driving around and I would always see their ads. And I knew they were a healthcare organization, but I didn't really understand. I knew they were a managed care organization, but I didn't really understand how that worked. And so that challenge kind of like intrigued me. And so I honestly, I think I just set my sights on that one because I really wanted to learn, what government paid insurance programs look like, how strategy and operations works in a managed care organization. And really, at the end of the day, just wanted to explore if that was something that I was interested in.
Yep. No, and so that makes sense because that intentionality we've seen, right? That intentionality leads to acceptances when it comes to
Yeah,
fellowship. So that's
right.
important. Did it what was it like working there? Did it live up to your expectation? Did you enjoy CalOptima? What do you have to say about that?
Honestly, I had an incredible experience. What I was One of the things that I was looking for in a fellowship was this challenge. And this was something that I had stated during the interview process that I was looking for an experience where um, I was thrown into challenges and projects and experiences I would where I would essentially be uncomfortable because I didn't know anything about it. Like I wanted to be uncomfortable and in order to grow. So there's that gap in between uncomfortability and uncomfortability and that gap is like where you can grow. And so I just really wanted that growth. And so the fellowship itself only had two rotations. So you do a 6 month rotation in one department and then another 6 month rotation in the second department. Being that this was the inaugural fellowship like cohort, so this was literally their first year of the fellowship that they had started. We kind of had it was myself and two other fellows who got recruited. We kind of had a little bit more leeway with how we wanted to structure things, and I was very vocal from the beginning in saying that I was interested in operations and strategy, which is what I wanted to pursue to see if I liked it or not. So I ended up doing my first rotation with medical management, which is essentially, learning kind of like the operations of care management for the organization's members. Um, During that time, there was an organization wide project that was going on. So the organization was sunsetting their old care management platform. Think of it like Epic, but for a managed care organization. And they were implementing a new one. And so that's huge because the platform they were sunsetting had been in use for like 15 plus years.
Hmm.
And so there's all these, departments that, what I walked into was that there was a lot of departments who were kind of like on the fence about even wanting to transition because obviously, they were comfortable with what they had used for such a long time. But regardless, the transition was happening. And so one of the executive directors of who was overseeing one of the work streams for this transition ended up leaving the organization. And a week later, I was being told that they wanted me to lead that work stream. And so this was very, very early on in the fellowship. Like this was like 2 months in. Like I had not even sunk my teeth into the complexity of the organization. And so I ended up, becoming lead for that work stream, and really gained this incredible experience connecting with so many different departments, gaining an understanding of what it means to be a healthcare administrator who works in operations. Right, you don't necessarily have what I learned. All in all, from that experience was you don't necessarily have to be a subject matter expert, as a healthcare administrator, someone who's working in operations, but you need to have the ability to connect the teams that know the subjects, know the subject matter. So, and I think that's kind of like a special skill in itself. And so that's something that I learned. And then I ended up staying with that project in medical management for close to 9 months. So that was like a huge chunk of my fellowship. And after that, I ended up moving into strategy for my last rotation, but I was only with them for about 3 months because the fellowship ended. But in strategy, it was that was an interesting rotation. I was able to gain an understanding of what kind of the grant processes look like, how the organization receives money from different state and federal bodies, and then how they kind of disperse that out to our communities. So, all in all, I had the opportunity to gain this kind of like 50,000 feet view from the strategy experience, understanding how the work that CalOptima Health does affects our communities and our members. But then, going back to the first rotation, I had the ability to zoom in and really kind of gain an understanding of like the inner workings of the organization. So, just a great experience overall that really prepped me for the next step.
That's thanks for that overview as well. I'm sure that potential fellows are definitely going to love hearing about that experience. That is awesome. One of the things that we've been trying to address is when evaluating fellowship programs, potential applicants often look at their retention rate and avoid programs with a low
Mhm.
retention rate. You decided to leave CalOptima. You did not stay there post fellowship, right?
Right.
Um, why did you choose to leave, and why should we maybe not use retention rate as an evaluator?
That's a good question. I'm going to start with the last question first, because I think that in the past, using the retention rate as an evaluator made sense. Years ago, I think a lot of the whole like underlying reason why people used to go and get their fellowships is because number one, they wanted to kind of catalyze their leadership and management skills. They were hoping that that would, kind of um, spearhead their movement into like a management role like right away. And in the past, that has been true of what fellowships were. I think that in the current time, in the present, with a lot of hospital and healthcare organizations still kind of reeling from the economic side effects of COVID. I think that that's a different that and the evaluation, the metrics that we use to evaluate fellowships needs to kind of change a little bit. um, I will say that I was part of a national organization during the time of my fellowship, the National Administrative Fellowship Network. And this is like a group of maybe 20, 25, even more admin fellows who were all kind of going through the fellowship process at the same time. And we were doing work to, help empower the next generation of administrative fellows. And out of that group, I would say the majority of us did not stay with our organizations. And I think that could be for many reasons, economic reasons, just also personal choice. Um, for me, I could see myself continuing on in the managed care industry. But seeing as I had prior experience on the provider side in like a hospital environment, I sort of felt that being in managed care was a little bit removed from the actual patient care that's taking place. And so, in essence, I kind of wanted to get back onto the hospital side of things.
Thank you for telling us about that, and then also sharing that from the NAFN there. That's really
Mhm.
important. I just think it's it's a shame to rule out places because of a metric that might not exactly be the best, right? And so I've been encouraging people to potentially look at institutions which provide an awesome experience like the one that you
Yeah.
had, and especially because your program is early, right? So their attention rate might be 2% or something, right? Since it's the first cohort, and that's not a
Exactly.
bad thing. So,
Yeah.
so after your fellowship, where are you now? What organization are you with? What are you doing for work?
So post fellowship, I'm now with UCI Health, which is just down the street from CalOptima Health, where I did my fellowship. And I absolutely love it. I actually did my graduate internship at UCI a couple of years back, and so it's I think it's kind of come full circle. I had an incredible opportunity. I think just by making connections with individuals in my ACHE network, and had a couple of really incredible opportunities. And UCI Health, I think has actually, I feel like, has gone global with their recent news of acquiring 4 tenant hospitals. And so, I believe they are now the largest health system in the whole UC system in California. And so it's just a really interesting and amazing time to be at this organization, because there's a lot of activation that's going on. We also have a new hospital that's opening next July in Irvine, California. So that with that new added hospital, as well as a rehab hospital, we will have, I think, 6 or 7 hospitals at that point. So the growth at this organization has just absolutely exploded, and with that brings so many opportunities for especially young professionals like myself to really learn and grow in their careers. And so a lot of my day-to-day work is really just um, project management, program management. I'm working on, I would say, 7 to 8 different initiatives. Some of them are related to operations activation at our new hospital. Some of them are that this one might sound really mundane, but I actually really, really love it. We're switching out the monitors in our hospitals from one brand to the other. And so getting the opportunity to kind of lead and guide that project from an op standpoint it's a great opportunity. And the teamwork between UCI Health and the organization that we're switching to has been incredible. And another really cool project is our concierge health project, which the organization, we do have a concierge health program. So it's just about kind of growing and building that, and making that available and accessible for our members in Orange County. And so lots of really, really fun things on the horizon. And my team as well is just growing. And so just a great time to be at the organization.
Wonderful. Let's get a little bit more granular real quick though. I want
Sure.
to talk about this monitor switch out. What does
Sure.
that workflow look like for you? You said it was really interesting. So what is, just so that we can understand the
Yeah.
kind of work that you're doing post fellowship, what do you have to do? Do you have to coordinate meetings or proposals? What does that look like?
So when I joined UCI Health, this project, was kind of had already been in activation for about a year. From an operations standpoint, I would say that one of the key things that I'm focusing on is our supplies. So as we're kind of changing out these monitors, they're patient monitors, and there's also a couple of items that we're tacking on to our anesthesia carts. And so with that kind of transition, you need different types of cables, different devices that like hook things up together, hook one device to another device. And so it's my focus right now is keeping track of all of those cables, all of those devices, and ensuring, working with our procurement and supply chain teams, being that kind of glue to ensuring that we have all of our supplies ready for our go live in every single unit. So for example, we actually had our go live in our Orange Hospital was this past Monday. So we went live in a couple of our units. Next week, we'll go live in our ED. The week after that, we'll go live in our pre-op and PACU. And so all of these areas in the hospital, they have different needs for different supplies, different cables. So it's ensuring that they have what they need and that their supplies will be replenished over time, and just kind of creating the workflows for that alongside some of our departments.
Excellent. That is really cool. I can see why you enjoy that though, because it's not as mundane as it might seem by the
Yes,
sound of it, right?
exactly, exactly.
Wow, that is excellent. Thank you so much for coming on and sharing all of this with us. That's so impactful, your journey, and I think a lot of the people are gonna who watch these are gonna really resonate with the things that you've experienced, and then also gain some really important advice. I hope we can have you back on as you get more and more experience. As you really form into this incredible executive and leader. I hope we can have you back on again to share some more insights.
Oh, I appreciate it. Yeah, absolutely. Let's keep in touch, and yeah, we'll chat again sometime soon, hopefully.